Well, let's start with the identifier first. Tell us who you are and where you graduated, when, and how you practiced.
My name is Dr. Jack Robinette. I graduated from Washington State College. This is before it was Washington State University in 1954. And I was in small animal practice for a few years, but most of my practice, some 25 years, was in the small animal hospital at Washington State University.
Great. Do you have any particular memory that you're fond of more than another during your career? Does anything stand out for you, or a series of things perhaps?
Yes, I could probably elaborate more on it if there were time, but my fond memory is going on sabbatical leave and training at medical facilities. The first was at Washington, University of Washington at the medical school. I was there on a 6-month sabbatical. And then my second sabbatical I spent at Sacred Heart Hospital in Spokane. In both cases I worked in the surgery department, and it was very, very beneficial in my career.
Mm-hmm. That's great. If you had to detail, or if you had to tell us that you had a mentor, who would that be, or is it a couple of people perhaps?
Well, that's easy. First, let me pay tribute to the two gentlemen that are going to follow me today in this interview, Drs. Clavinaugh and Dr. Gorham. They were both my teachers when I was at Washington State. But my mentor has to be Dr. Richard Ott, who was the longtime department chairman at the veterinary clinic at Washington State. And he hired me right out of school. I did a 1-year internship, instructorship in the small animal hospital. And after some private years in practice in Boise, Idaho, my hometown, he hired me back. So this man hired me twice, and his contributions to veterinary medicine are absolutely outstanding. He was just one of a kind.
Yeah. They've named the small animal section of the veterinary teaching hospital now at Washington State University after Dr. Ott.
Yes, I know that, and it's very much appreciated and very well deserved. And I think there's a chair in his name, an endowed chair, and we're all proud of that. And I just have to say that I think one of his greatest contributions to our profession was developing, in conjunction with Dr. Gorham, who will be on here pretty soon, a new and improved vaccine for canine distemper. It revolutionized the handling of that disease, which was just a scourge in the early decades of the 20th century. And those two men deserve full credit for essentially eliminating canine distemper. We rarely see a case anymore.
Well, knowing all three of you gentlemen, I'm always humbled by everything that's happened, but I didn't realize you were the youngster in all this, and that you were actually taught by both of these fellows.
Yes, I was, Ed, and Dr. Ott.
Charlie, let me stop. Sure. Okay. Okay, you want me to count for you?
You can go ahead and continue.
Okay. Graduating in 1954 and being a clinical instructor and surgeon has put you in a unique position to look at the changes coming in veterinary medicine that have come over the years. And now that you've been retired, it even gives you a different seat. What's the biggest change you think you've seen in veterinary medicine?
Well, I'm not sure if it's the biggest or not, but one of the most dramatic is the change of the people in our profession. Now there are at least 50%, if not more so, 50% women in the profession, and I think this is well deserved. It's high time they recognize, and they're doing very, very well. A technical change, and this might be getting into Dr. Clavinaugh's area. He was an expert in anesthesiology, but the anesthesia that we have today is just absolutely miraculous compared to what it was when I was in school and before that. And following that up, all of our small animal patients are under some form of pain management program post-operatively, and those are real big changes. Another that comes to my mind is board specialization. We have specialty boards in surgery. I'm very proud to be a diplomate of the American College of Veterinary Surgeons. We have them in veterinary pathology, radiology, medicine, right across the board. And I think those are really a lot of the major changes that we've.
When you were growing up in Boise and before you landed in Pullman, Washington, what motivated you to become a veterinarian, or had you always thought you would be a veterinarian?
That's a real good question. Boise was my hometown, but my grandparents on the mother's side that I dearly loved ran a small farm over in Blaine County, some 150 miles from Boise. It's in the same county where Sun Valley is. And I spent every summer on that farm from the time I was born until I entered the Navy in World War II. And I literally fell in love with horses. I wanted to take the horse and bring it to Boise, but Mom and Dad wouldn't let me do that. But then also there were dogs and cats, livestock of all kind. And so I really, really had a feeling for farm animals particularly, and also dogs and cats. Well then, after I was out of the service, I attended the University of Idaho and decided, boy, I'm going to major in agricultural studies and pre-veterinary studies, which I did, and was very fortunate to be accepted into veterinary school with my first application in 1950. And of all people, again, to come up today is Dr. Clavinaugh, and he was on the admission board when I got in, so I remember that very fondly.
What do you think, looking back now on your career, and I realize that your wife has a practice, you still are in practice to some extent, what's been your most significant personal contribution to veterinary medicine during your career?
Well, I think that probably goes back to my time when I was on the small animal faculty at Washington State. I became board certified in surgery in 1976, but in my sabbatical leave at the medical school at the University of Washington, I learned a lot of very valuable surgical techniques from physician surgeons that I had the great opportunity to scrub in with in both the canine laboratory studies going on over there and in the human OR. And I learned some surgical techniques and instrumentology that we just didn't have on board yet here at the veterinary school. And I think that is the thing that I brought back to my students that I feel was a major contribution.
Mm-hmm. That's fantastic. Everybody that has a career in medicine, it seems, because it's such a unique way to earn a living, has some unique story that they recall. Are there any that really stand out in your mind about specific cases or people that you served while practicing veterinary medicine, especially as a surgeon?
Yes, there were several, both when I was in my private practice years in Boise and here at the school, but there's kind of a cute story that happened here at the school. The second grade class from one of the elementary schools had a pet guinea pig in there that they had for show and tell, and then it became the class mascot.
Right.
Well, this guinea pig's name was Rosie, and she developed a bad tooth. And so teacher gathered up all the class, and they came over to the veterinary hospital to look at Rosie's tooth. Well, I happened to be the clinician on duty, and I looked at the tooth, and it was just barely hanging in position, and it was pretty easy while the kids weren't looking, just to take a gauze and remove that tooth, which I did. And Rosie, of course, immediately started feeling better, and the kids were all excited about this, and the nice thing about it was the teacher had them write me thank you letters so it was over. And one or two of them were really memorable. For example, they said, "We were very good on Tuesday. Teacher let us have ice cream. Thank you, Dr. Robinette, for taking care of Rosie's tooth, and thank you for not charging us."
Oh.
That's a memory that is one of many, but it's a nice one.
Yeah, that's fantastic. If you had it to do over again, is there anything you'd do differently now? Is anything intrigue you about modern veterinary medicine?
I don't think personally there's anything I would do differently, because all my career, even before I was a veterinarian, I've loved to work with my hands, be it working with tools. I did a lot of electrical work when I was in the service, but I've always loved surgery. Even as a student, I like that phase of our profession more, so I would not be happy if I had to do over again if I wasn't using my hands. But I want to hasten to add that I think with surgery is fine, but there's so many people going beyond and doing advanced work in research, in surgical research. I had the great opportunity while I was here in association with Dr. Jack Alexander. We had a large grant that we were doing left ventricular assist pump installations in a bovine program, and it had a lot of money into the school, and it helped a lot. But the vascular surgical techniques that I learned while I was at the medical school helped get us through that, and I enjoyed that a great deal. There's one thing that I think is so attractive to the future of our profession, and that is genetic engineering. If I could go on and do that as well as surgery, I'd be completely happy. Right. If I had to do over again.
That's great. Thank you very much for your time today, Dr. Robinette.
You're welcome, Charlie. I'd like to tell one funny story.
Sure, absolutely.
Some years ago at the veterinary school, I had just finished lecturing to my students on instrumentology. This is a scalpel, this is a hemostat, this is a retractor, and they'd go by personal names, some of the retractors, a Parker, a Harrington, this sort of thing. So I'm on reception one day, and in comes this emergency case. A dog had been hit by a car. And one of the students was assisting me, whom I had just finished this class lecturing to on different instruments. And this dog was in bad shape. I mean, I had the stethoscope out and we're listening and everything, and it really needed to be transported off to the ICU unit, intensive care unit. So the students were all handing around, wringing their hands, and what do we do, Dr. Robinette? I said, well, so-and-so, go get me a gurney. And so the student went running down the hallway to the instrument room, and he said, quick, he talked to the instrument room technician, he said, quick, Dr. Robinette needs a gurney, hand me one. And she says the gurney is parked in the hallway right around the corner. One of the funniest stories that ever happened to me.
That's great. Thank you so much.
You're welcome, John.
All right.